Betha Schnelle is the Chief Operating Officer of Planned Parenthood of Orange and San Bernardino counties. Betha has overseen the operation of 9 health centers since 2007. Under her leadership, patient wait times have been reduced to under 15 minutes. The affiliate has consistently maintained Yelp review scores of over 4 stars. Patient volume has grown over 30% in 7 years. Revenues now exceed $90 million. Betha has also helped manage the PPOSBC's expansion into primary care, and she led the implementation of new online health services on the PD Direct app. Betha earned her MPH at UCLA, an MBA at UCI, and a bachelor degree at UCLA.
My name is Betha Schnelle. I just wanted to start with this first quote here. You can tell the condition of the nation by looking at the status of women. From actually the first Prime Minister of India, written almost 60 years ago, but I think still very relevant today. Next slide, please. I'm Betha Schnelle. I'm the Chief Operating Officer of Planned Parenthood of Orange and San Bernardino counties, and I have a brief presentation here to talk a little bit about women's reproductive and sexual health and how it's being impacted by COVID, as well as the response that we've had to the COVID crisis and also the state of abortion care in the United States. Next slide, please. So I wanted to just start with a couple of definitions, this comes from Reproductive Health Access, I believe, that, women's health really is equivalent to high quality access to quality sexual and reproductive healthcare services. Reproductive health is fundamental and integral to women's overall health. For young women, the annual visit to the OBGYN is often the only consistent contact that they have with the healthcare system. And women 19 to 34 are reportedly more satisfied with their care when their regular provider is a reproductive healthcare specialist, such as a gynecologist. Next slide, please. Again, just a few slides on definitions. This is the definition of reproductive health care by the Californians for Reproductive Justice. I believe I can't see my bottom of the reference at the bottom, but this was defined. Reproductive health care is defined as quality maternal and infant health, timely birth control access to abortion services, STD prevention, testing, and treatment, and gender-affirming care. Next slide, please. So where do women get these reproductive and sexual health care services? Most of us see a primary care provider once a year. There have been efforts to really integrate specialized reproductive health care into primary care visits, but challenges with receiving, really excellent reproductive and sexual health care in the primary care setting include, the primary care physician has insufficient time for detailed preconception, life birth planning, counseling. They're addressing many issues in one 15-minute visit. Also, it's very difficult to keep a generalist primary care population trained on some of the Tier 1 more advanced procedures, such as the Tier 1 long-acting reversible contraception that includes both IUDs and implants. They're very expensive to keep on your shelves, and they require a lot of training from the provider. So if you're not doing them very often, as a regular PCP office might not, it's very difficult to get good and have them and get good at providing that access. Also, just again, all doctors know this, the specialized nature of medicine, research, new information comes out regularly. It's very difficult to stay on top of everything, at which primary care encompasses everything, and reproductive health care is its own specialized field with constantly new research and information coming out that makes it hard for a PCP to stay on top of that. And we have seen both in studies, and I'll show you some of our own focus groups, that oftentimes women report not feeling extremely comfortable discussing issues of sexual and reproductive health with a primary care provider for fear of being judged or looked down upon for these discussions or their lifestyle. Next slide, please. These are some focus group findings I just wanted to share with you from our own Planned Parenthood group of patients that we do pretty regularly. We do a pulse check, and these are just some of the themes of the comments that we hear often. They prefer to see women's providers for sexual and reproductive health care very often because they feel like the women have gone through it. They have that experience and knowledge. This comment, I feel there is no judgment. It comes up over and over again that patients feel that in their sexual and reproductive health care encounters, it's incredibly important to them to feel they can have an open dialogue with their provider without judgment. And then this last one, again, sort of highlights what I was saying before, which is folks can go to their primary care provider, but often they can't get STD testing and birth control there, which are two of the principles of sexual and reproductive health care that are critical. Next slide, please. So I got through 5 slides in healthcare without mentioning COVID yet, which is, I think, sort of a phenomenon right now. And since March, it seems to be all that we can talk or think about in healthcare. And the impact of COVID on sexual and reproductive health care is enormous and can't be understated, starting with, there is a direct threat to the dollars that are going into both the primary care system right now, as well as the reproductive and sexual health care system. Many of the financial resources of the hospitals and the payers are going towards preparing for and fighting COVID. The state budget is, as you know, has an enormous deficit, and there are threats of cutting funding to primary care and reproductive providers that we are now having to focus on lobbying against. So that's probably one of the biggest threats, is just this diversion of financial resources from the reproductive health care and primary care safety net. Planned Parenthood serves a primarily low-income population, so we give a lot of thought to how will the social determinants of health impact our patient population. And we know that there is going to be increased fear of using public transportation to get to the health centers, lack of childcare that we're experiencing at every level of society that will prevent women from being able to get into their reproductive health care visits. And of course, we all know that most people get their jobs, their insurance through their employer right now. With the unemployment numbers at over 30% now, and a disproportionate impact on women losing their jobs, this means a great loss of insurance, which will mean greater gaps in care for women when they can't get care without worrying about having, the financial impact. We are hearing from our own patients, and we know that primary care practices, especially smaller shops across both counties, we serve Orange and San Bernardino counties, practices are closing and cutting back services. Many of the smaller shops can simply not absorb all of the screening and telemedicine, all of the changes that you had to make within a 1-month timeline to really manage patients during the COVID crisis. And finally, as mentioned earlier by the speaker before me, across the board, the American Medical Association, CDC, ACOG, AAFP all came out and recommended that preventive screenings be delayed because this is this risk management decision, right? I mean, there's a bigger, the risk of having thousands of patients in your health centers versus not getting preventive screening was what every provider was weighing. But specifically in the sexual and reproductive healthcare arena, what this means is since March, most providers, including ourselves, have not been able to do well woman exams. Even at the earlier speaker was discussing, this is just an example in the Planned Parenthood arena, the incredible explosive growth of syphilis in the state of California, which has also disproportionately impacted women of color in the past 5 years. Planned Parenthood was very proud that we were testing everybody with a blood test for syphilis And that has basically been cut back by almost 60% just because we can't have patients in our health centers for this extended period of time to draw their blood and get this testing done. So it's this difficult decision we're always weighing between contagion of this disease versus the discontinuation of these preventive health services that we know will lead to a public health crisis in the future. Next slide, please. There have been some amazingly positive impacts of the work the healthcare system has done to respond to the coronavirus. So many of the barriers that our patients faced and of the regulatory hurdles that we faced as providers have been eliminated practically overnight. If you had told me before this happened that it was going to happen in healthcare, I would have said, I don't believe it because things don't move that quickly in healthcare, but these are just a few examples. We can now remotely enroll patients in Medi-Cal and presumptive eligibility, which is emergency Medi-Cal for women seeking pregnancy-related services, so pregnant women, and FPAC, which is the family planning emergency branch of Medi-Cal that can be used to cover sexual and reproductive healthcare services. We can do these all remotely now. They used to require an in-person long application signatures. We are now able to do it either via text or verbally. Video and phone visits are both covered at the same office rate visit as in-person visits. And this has been an enormous boon for providers because we can now provide these visits in a way that patients want to be served without worrying about devastating our practices financially because we can get paid for it. In our personally in Planned Parenthood, our show rates for these video visits are 20 to 30% higher than our in-person visits, which I think again speaks to the fact of the disproportionate impact of the social determinants of health on our patients, such as lack of transportation, job shift insecurity that prevents them from making appointments in the clinics, much higher show rates on the video, so better access for patients. We can consent patients online, medical consents, privacy notices. Many utilization limits have been removed from plan coverage. And there was some early information sort of out there about, oh, there's going to be supply chain management problems. There might be a condom shortage, birth control shortage. We have not seen that. Our supply chains have been consistent and healthy throughout this pandemic. Next slide, please. So just a little snapshot to give you, the snapshot of Planned Parenthood, the organization that I'm the Chief Operating Officer of. Is, we serve about, in Orange and San Bernardino counties, we serve over 100,000 patients in a year, and it's over 1 million in the state annually with 108 health centers. We are 95%, patient population is 95% identifies as female, 90% low income, and about 90% of our services are birth control, preventive health, STD related, and primary care, and about 7 to 9%, depending on the affiliate you're speaking of, is abortion services, and we do both medication abortion in all of our health centers and surgical abortion in select locations. Next slide, please. So this is sort of our mantra since March, I think. In Planned Parenthood, everything in the world is a fomite. We see about 2,000 patients in our health centers every month. So just the amount of close contact between patients and providers is enormous in our health centers. So we were required to have a really quick scale back of our services in order to protect our providers, which we really focused on the protection of our providers and our staff first and foremost when this hit. Next slide, please. So this is basically how Planned Parenthood, Orange and San Bernardino counties dealt with how to continue providing care, is that we implemented drive-through visits. So you can see here we're offering pills, patches, rings, emergency contraception, CT treatment, STI screening, all through drive-through now. So the patient drives to our health center, they log into their phone, they have a video visit with our provider. At the end of the visit, they roll up their window and our medical assistant brings out a brown bag of medication and STD screening supplies to their car and leaves it on the hood of their car. So it's a completely no touch, no contact visit, except for in the case of Depo, which we just added. If anyone can figure how to do no touch Depo, that'd be great. But we have not figured it out. So these are the services we're offering through drive-through. And our in-health center visits, you can see over here on the far left, we're still seeing anything that would be considered urgent. We have an enormous amount of UTI, urinary tract infection, STD infection visits where people are in immediate pain and need help. We are triaging those patients in the parking lot. We are doing absolutely everything with them we can over video in the car, and then bringing them in to the health center just for that hands-on piece. And then over to the far right, you can see the services excuse me, that we are still not currently able to offer, which does include well woman visits. We do plan to add those back in the next month. And we're looking at perhaps doing a HPV self-screen in the drive-through to determine who needs to be brought through or not. But really our focus has just been on keeping that in-clinic time as low and little as possible to protect both our staff and the patients. Of course, we're doing all of the screening of the symptoms and masking everybody as well. Next slide, please. So just to sort of round this discussion out, what is Planned Parenthood looking at in terms of reproductive, sexual and reproductive health services right now, and what's being attacked, what's our immediate threat. The recent, the Title 10 gag, which I'm sure you're all familiar with, according to the Guttmacher Institute, reduced family planning system capacity to provide contraception services by 46%. It was pretty significant how many providers had to drop out of the Title 10 program due to this gag order that we can't refer or provide abortion services to our patients. Most recently, my affiliate in specific qualified for a small business loan, and in good faith, we applied for the small business loan. Our volume, like many others, was cut to 50%, and we had serious revenue concerns. Just in the last few weeks, we have been disqualified from receiving an SBA, small business loan. The claim is that we are a federated model, and we know that we are specifically being targeted by Mitch McConnell and the other Republicans in Congress who wrote this letter to say that we should be disqualified because there are many other federated organizations that are receiving and have received small business loans. But we did end up having to give ours back, just exacerbating the financial losses that we have suffered in the past 2 months. There are also many state-level efforts to define abortion as a non-essential service by the governors in those states, and I'll show you that slide in a minute. Fortunately, that has not been the case in California, where we have an extremely supportive legislature. And then lastly, we always look at what the Supreme Court is looking at, and the 2 biggest cases that Planned Parenthood is really focusing on related to sexual and reproductive health this year, this summer and spring, is the case requiring physicians to get admitting privileges to hospitals in order to provide abortions in the outpatient, in the ambulatory setting, which we know is unnecessary and also will cause abortion providers to not be able to provide services in those states where they cannot get admitting privileges. And the expanded consciousness exemptions that they're looking at, allowing more employers, not just religiously based, to exempt or opt out of providing birth control coverage to their employees through that employer-sponsored care, which we know is the #1 way that women are covered in the United States for healthcare. Next slide, please. So this is almost my last slide. There's so much misinformation out there about abortion that I always like to put out some actual facts that are researched. I highly recommend going to the Guttmacher Institute if you want additional information. They're an excellent, highly reputed research organization. So 1 in 4 women will have an abortion by the age 45. This is why Planned Parenthood's stance is that abortion is an imperative, integral part of women's sexual reproductive health care, and we refuse to not provide it. 59% of abortions are by patients who have at least 1 child, 75% of abortions below poverty level, and 51% of abortion patients were actually using some kind of method at the time, including condoms or a short-acting hormonal method, which would be a birth control pill that was maybe not taken correctly. There was an amazing study that came out just before COVID hit by this study, National Bureau of Economic Research, which tracked women's credit scores in a 5-year period following the date at which they were denied or unable to receive an abortion. And they found a large and persistent increase in financial distress for women who were denied an abortion by looking at their credit scores. So we know that this impacts women's financial health for years to come. Next, please. And so this, I was referring earlier to the number of states who have basically said that abortion, try to put governors that have put policies into place to say abortion is a non-essential service. You can see there's about 11 states. As usual, it's clumped around the south of our nation. And unfortunately, these are the same states that many of them, I think all of them I'm looking at, most of them failed to expand Medicaid. There's very little access to birth control and preventive health in those states to begin with. And now the governors are using the COVID crisis to say these patients also should not be able to we should not be providing abortion. It's not an essential service. And most of those have been stayed in the courts, but it's still being battled out. Last slide, please. I just want to thank you all for having me today, for Allison Sonnenschein for her incredible leadership. I've looked up to Allison for many years for bringing us all together and all of the work and effort that went into this. I have very, very simple takeaway call to action for you. If anything has upset you about what you've heard in my presentation, if your priority is to protect women's sexual and reproductive health, this last slide, I think, says it all. Please register and vote this fall. Thank you.